Hi everyone, how are you doing today? Today we will talk about the abnormal development for lecture 9. We talked about some developmental issue in counseling in the last lecture. So we talked about some general characteristics and different theories in developmental psychology. However, today we will talk about some the other side of the development, which is abnormal development. Because when we work with the client, we see many clients with some developmental disorder, which caused by some abnormal development. So we want to know what the abnormal development is and some characteristics, and how can we help the student with abnormal development. So let's take a look at some objective for lecture 9. The first one is we want to compare different theories explaining abnormal development. And there are many different the theories here, and I categorized 4 different ways, and biological and psychoanalytic and learning theory, which is a behavioral approach, and the final thing is humanistic theories. We have reviewed the theoretical perspective in many different lectures. You know, when we learn the counseling skills and even consultation and group, it's about the same way. We want to apply this conceptual framework to understand the student with abnormal development as well. The second one is understand the basic components of DSM-4. DSM-4 is a manual. It's like this thick, big, the book, which has all different types of disorder. And it uses 5 axes to help diagnosis and treatment for each the disorder. So we want to explore and we want to learn some the components of DSM-4. The final thing is identify major medications for abnormal client. Well, as time goes on, when I work with clients, I see so many clients are taking medication. The medications are so developed and now much less side effect, and it's pretty effective. I know the people are still concerned about taking medication. And I also see the different reaction between Korean or Asian people and some Western the people, because the Korean and Asian people are more concerned about taking medication as a cultural reaction. But anyway, we know there are so many different medications, so we want to review some information about the medication as well. The biological approach, genetic and biological explanation. When we look at some client with mental disorder, now we know as a development of medical field, their symptoms are originated by the biological reason. So if we identify and if we confirm their symptoms are caused by the biological reason, we want to treat them with a biological approach. For example, I gave some example with student with ADHD. Still remember that? Attention deficit hyperactivity disorder. Well, in the long history of identification of a student with ADHD, now we know the symptom of student with ADHD are related with biological reason based on some development of medical machine such as MRI. Have you heard about the PET, like a PET scan? That's very advanced the scanning picture of like a brain and some, our bodies, and it shows even function of our body. So functional MRI, it's called fMRI, and PET scan shows students with ADHD are different from the people without ADHD. So we confirm that their reasons are caused by some biological reason. That's why we try to help them with a biological intervention. The biological approach, some inherited traits are expressed with client a certain condition. So, not all students with ADHDs are showing the same symptom because their symptoms are expressed based on a certain condition. But we still know the trait may be the function of gene, so it is inherited. For example, ADHD. How many percent do you think we have the ADHD in our school or in general? How many percent of the population would have that, the disorder? Do you have any guess? Medical experts say it's about 3 to 5% of the whole population would have some the attention deficit hyperactivity disorder. So that's not many. So if we have student with ADHD in our classroom setting, in Korean classroom, we have about 30 to 35 students in general. That means we would have one student with ADHD in average. However, if an adult with ADHD is pregnant, and if that person give a birth a baby, and the probability of having ADHD of that particular baby is about 30 to 50%. That is 10 times higher than the regular person. So that means, is highly related with the gene and inheritance. And also, they also investigated some strong relationship between identical twins. So trait may be function of gene, and environment can affect the biology, because we know when they investigated the reason of ADHD, they identified some influence of the environment to the pregnancy. So that impact on their the biology as well. So these are the general medical approach to the mental disorder. And as I said, the biological intervention usually majorly include the medication. I put down the picture about the medication, and there are so many different medications right now. And it's pretty prevalent. In some sense, it's a little bit sad, because when I work with clients, and if I see some, very typical the mental disorder, and when I consult with the parents, and sometimes I refer the student with the other professional, usually psychiatrist. So they, the parents take the student to the hospital. And about 90% of my clients, they begin to take some medication. So it's pretty normal and pretty general procedure right now to take medication. So the medication and stress reduction and using some physical movement like exercise and proper amount of sleep, this type of approach is one of the biological intervention. So biological approach is not a role as a counselor, but we want to know this because we want to and we have to work together with other professionals in the biological field. So we want to have some basic understanding of this approach. So from biological perspective, they believed the reason of their symptom is originated by gene or inheritance, some physical and biological reason. However, in psychoanalytic approach, it's different. It's not by some biological and generic component. In this perspective, they see their problem, their symptom of a certain mental disorder is originated by their past experience. Do you remember that one of the characteristics of psychodynamic is determinism? So they stressed the first 3 to 5 years of their life. And also we talked about the structure of the personality here. If you look at this big iceberg and the ego and superego and id, for example here, you know, we have 3 different components. So ego, id, and superego. We talked about the id is the basic instinct, right? It follows the pleasure or principle. It is more the sexual drive and also aggressive drive. It's a very intrinsic instinct power of our life. But it is controlled by ego because it follows the principle of reality. And also they are, the superego, it's influenced as a kind of the judgment. So these are all together is a kind of, consist of the personality structure, and it's moving around. When try to eat is, evolve, and ego try to, let it down. So that is a kind of dynamic. That's why it's called the psychodynamic theory. And if you look at the next part in his theory, the Freud suggested different psychosexual stage. If you look at here, the first 3, oral stage and anal stage and phallic stage, that is from the birth to 5 years. He believed these periods are critical to our life. And if we experience some issues in this period, and that will impact and influence on our abnormal development. For example, oral stage from birth to 1.5 years. He believed that attachment to caregiver is one of the important issues, and it was repeated by the Mahler object, relationship theory. We also reviewed this issue by Erickson in the last lecture. So when a baby is able to have a very secure and safe attachment to the caregiver, and then the baby will grow as a normal person. But he believed that if the baby is not experiencing secure attachment to caregiver, and then mistrust issue and relationship issue and dependency will be a big issue, not only in this period, but also the later life in that person. And even anal stage and toilet training, because that is one of the major tasks as well. Because from birth to the 1.5 year, baby is pretty dependent to the caregiver, and their life is pretty cared by the parents. So the parenting is very important. But from 1.5 to 3 years, a child has the first kind of the rule in their life. That is the toilet training. And the parents are very, are very interested in and very care for their parenting for the toilet training. And Freud believed that when we train for their either for the this issue if we are too strict, and then that will impact on their abnormal development. So this is the parenting style's impact on personality. And one day I was reading on expert the article about this issue because as time goes on, he believed that more people are more aggressive in modern days. And that psychiatrist explained that because that types of the pattern, the more aggressive people right now is based on and originated by stricter parenting style and toilet training. So he compared that, the long time ago, the toilet training was not too strict, even in Korean society. They just learn by themselves. But now it's very, strict compared to the past. That was his interpretation. And Felix stage, and this is the stage that they begin to identify the different sex. So awareness of opposite sex. So the child is trying to identify with the same sex. For example, for a boy tries to identify with the father, and then begin to aware of the opposite sex. For example, a mommy. And in the relationship between father, mother, and a child, and they begin to like Oedipus and Electra complex. So if they are not able to resolve that conflict between them, they would also experience some abnormal development as well. So based on this stage theory from psychoanalytic approach, the key point from this perspective is that their abnormal development is originated by their past experience, in particular the first 3 to 5 years of experience. Next one. Behavioral approach. We have already reviewed 3 different approaches here. Classical conditioning by Pavlov, and operant conditioning by Skinner, and reinforcement was one of the major the concept. The final thing was the social modeling by Bandra. So he stressed that it's more a person's active observation and imitation of other person's behavior. But the key points from this perspective is that the behaviorist to see a person's abnormal behavior that was kind of learned behavior. So they just learn for some reason. Let me give you some example here. Let's take a look at from the Pavlov perspective first, the classical conditioning. So if a student experiences like low grade in math, for example, low grade, that will be a stimulus. Do you remember that the classical conditioning is based on the stimulus and response framework? So low grade will, result in some negative feelings about themselves because, I got like a low grade and C minus or whatever. So kind of negative feeling. Okay. How in this framework, the low grade is connected with, for example, math. Okay. Do you see some kind of similarity between a dog's experiment of food and saliva and then bell sound? So if math is and low grade is connected, in other words, whenever the person takes the math exam is low grade, And then finally, this mess will cause some negative feeling, for example, anxiety. Do you see a different explanation here? From behaviorist perspective, anxiety disorder is not caused by the biological gene or inheritance. Anxiety disorder is not originated by their past experience that they don't remember. Anxiety disorder is something that they learn by experiencing repetition of low grade and math test. And they'll cause that anxiety by this framework. Okay? That was the classical conditioning. And operant conditioning was different because from the Skinner, he believed that not from stimulus and response perspective. Here. He believed, for example, not only from stimulus and response perspective, he believed additional some positive reinforcement or some punishment. So when a student get a low grade and negative feeling, and if the student receive frequent punishment, and then that experience and that reaction will be reinforced by experiencing the different consequences. That is the by Skinner. And Bandra explained that, if a student observe a student with this situation, and they will learn by, this vicarious experience. So anyway, the concept of the behavior perspective is they try to explain our abnormal development from this perspective. They just learn that abnormal development. So from this understanding, a person is born with the multiple personality characteristic. So there are both possibility, and if positive characteristic is reinforced, and then they will develop normally. But if the negative characteristics is reinforced, and then they will experience abnormal behavior and development. So the abnormal behavior as a result of a reinforcement, and also they believe, by learning new behavior, by replacing the maladjustment with the new behavior, they believe the person will get over. So these are the behavioral approach. The final approach that we wanted to review for today is a humanistic. Humanistic approach, I put the first person is Maslow's the need hierarchy. This perspective is different. You see 5 different hierarchy. The first bottom level is a physiological. That is more physical and the biological related issue, as breathing, food, water, and types of things. And the point of this theory is this level, for example, level number 1, and if it is 2 and 3, 4, 5. The theory of this says if we want to satisfy the second level, and then the first level of need has to be met, because that is the kind of requirement for the next level of need. And so 1 and 2 will be the requirement for the 3, and 1, 2, 3 will be requirement for the 4. So this is the main idea of this humanistic approach, in particular Maslow. So from this perspective, if someone has some abnormal behavior, and then from this perspective, for example, Maslow believed because the lack of satisfaction or lack of lack of satisfaction, a lower level of the need will result in some abnormal behavior. For example, one of the issues here, the safety in the second level from the bottom, that is the security of body. So if we have school violence, if a student is exposed frequent violence in school setting, and then the student is not able to show some achievement, because achievement is the higher level of the characteristic. So even though a student is able to do it, but if that particular student doesn't show that achievement, and then the student cannot show normal development because of the student is not meeting the need of the safety issue here. So this theory explained that our abnormal development is the lack of the satisfaction of the lower the hierarchy in this perspective. The next one is Rogers condition. Do you remember that 3 core condition by Rogers? So he believed that if we are able to provide these 3 core conditions, the first one is genuineness, like a congruence and authentic attitude to the client. And also if we are able to show some non-judgmental and unconditional positive regard. And if we are able to show some empathic understanding, if we try to show our attitude, I understand you from your perspective, and I'm also feeling what you are feeling. And then the person will grow and then will show some normal development. But if we are losing one of them, and then it will cause some relationship issue, and that will impact on their developmental issue as well. So humanistic approach is totally different too. So we talked about some 4 different approaches in biological and psychoanalytic, and some behavioral and humanistic. And one of the things that we want to review for the lecture 9 as a part of the abnormal development, we want to know some term from the some diagnosis. It's called the DSM-4. DSM means like a diagnostic and statistical manual, and it contains all information about the mental health disorder issue. So it contains disorder's main feature. For example, like attention deficit hyperactivity disorder. What are the subtypes? There are 3 different types in ADHD. And what are the variations in client presentation? What would we see some characteristic of student with ADHD? What would be the typical pattern and course and progression of the symptom? So it's pretty informative book. If you look at the library, you can look up the all information from the DSM-4 manual. And DSM-4 manual use 5 axes, and each axis has different characteristics. So if you look at here, the axis 1, and all disorder except personality disorders or MR. MR means mental retardation, 정신지체 in Korean, because axis number 1 is more clinical disorder, which could be treatable, so we can help the client be better. But axis number 2, personality disorder and mental retardation, these are the disorders that it's really hard to treat, and they really show little progress compared to the other disorder. So they put down the axis number 2, that disorder. Axis number 3 is general medical condition. So if a client has some medical situation. If, for example, if a client has a heart issue and some other brain issue, and then the psychiatrist, they explain some information by using some axis number 3. And axis 4, psychosocial and environmental issue. Axis 5 is global assessment of functioning. Is a clinical assessment of a person. When from medical perspective, psychiatrist or psychologist, okay, this person would work and would function at this level. If you look at the textbook, the table 10.2 shows some criteria for a global assessment. It's called the GAF, G-A-F. So here, these are the examples I wanted to let you understand better what is the DSM-4, and these are some example of one of my real client. These are the table that I saw when I had a client. Okay, when I worked at the community counseling center, one day I met one client, and before meeting the client, I looked at some paperwork that explained the client symptom and the history and situation. So, you know, that documentation was given to me. When I look at the person, the client's information, the first page, there was a table exactly like this. And it was completed by the psychologist. So the licensed psychologist or psychiatrist are able to diagnose a person. In this case, you know, by using the DSM-4, that psychologist used 5 axes. So axis number 1 is attention deficit hyperactivity disorder. He was the male student in the 5th grade. As I said, the DSM-4 also explains some subtype. One of the type was a predominantly inattentive type. So he was not impulsive. He was not hyperactive. He was pretty calm student, but he was he struggled in concentrating on teacher's direction types of thing. And also, he was not fluent in speaking English. So he was also diagnosed by as expressive language disorder. So axis 1 show some clinical disorder, and axis 2, it was about, you know, personality and the mental retardation, but it was not the case. Axis number 3, he didn't take any medication at the time, so no medical condition. And axis 4 is psychosocial stressor, in particular poor relationship with brother. He was the second child, and the older brother was very smart and very a little bit aggressive. But the client was 2 years younger than the older brother, but he didn't show really high achievement, you know, low achievement, and also some, you know, disruptive behavior in the classroom. So the parents always compare to the first and the second child. That was one of the stressors to the client. So that the poor relationship, and also he was an Asian, and so the family was kind of experiencing some cultural diversities, you know, because their 2 children are exposed and they are growing in the American education system and American culture, but the father and mother are all Asian. Their English were not fluent as their the children, and they still kept their Asian values. So some bilingual and multicultural issue as well. That is a social, you know, some condition here. And when psychologists conducted some assessment for the global functioning, it was 50 before. If you look at the table 10.2, the 50 means a serious symptom. but it has been improved to the 70 right now. The 70 is some mild symptoms, so the client is showing some improvement for the past 3 months. So every 3 months, the licensed psychologist see the client and assess the client in a regular way, and this is one of the examples of the DSM-4. Psychopharmacology, that is about the medication. There are many different medications are developed like this. Antipsychotic, that is like a schizophrenia, and also mood stabilizing drug, like for the bipolar disorder. You know, one day is very excited and the next day is very depressed. It's called the bipolar. And depression, they are taking some antidepressant. Anxiety disorder, anti-anxiety medication. And stimulant, like attention deficit hyperactivity disorder. Some people guess probably they would take some depressant, not really a stimulant, because they are very active and not really paying attention. So if they're taking some depressant, they will be, showing some better behavior. But that's not. They're actually taking some stimulant. If they are taking some stimulant, and actually that stimulant stimulate the brain system, so that the frontal lobe, that is the part that controls their behavior and impulsivity. So the stimulant actually activate the frontal lobe, and as a result, they are able to control actually their behavior. So they're all different types of medication. But here, I wanted to stress, medication is not only solution. We want to combine with other approach as well, like a medication. In addition to medication, counseling, and in a interpersonal way, and also we can provide some educational intervention by classroom teacher. If we need, we can ask some other advanced and information from consultant, and also we can apply some behavioral modification plan. So these are the better and the best approach that we have found so far. Medication is not the best way. We want to enhance the intervention by combining with other approach as well. Well, the final picture shows some interesting result about the medication. These, the two pictures are showing some improvement of the student with ADHD. Let's take a look at the first picture here. This is the following direction. So the 100% means 100% of the students with ADHD were able to follow direction, and 0 here. This is the result of the one experiment. They collected and they recruited the student with ADHD as a camp, and they provided educational intervention for about 40 days. So pretty long and pretty intensive intervention. You know what? The first days, they are not able to follow the rule, and only 40 or 45, 50%, and that is understandable because students with ADHD is not good at following directions. So they only lower than 50%. Usually, at the first day, they show pretty high percent here. But the black square means the medication. So the experimenter gave the medication, but actually the medication was fake. That was like a vitamin, was not the real medication. That's why it was showing only 50%. But there's no specific medical factor because it's only vitamin. It was fake pill. But let's take a look at here. When they give the real medication, the triangle is the real. It went up to like 100%. That is the result of medication. We know, wow, it's very strong, right? it was around 50%, but at the first day of taking real medication, it went up to like 95%. So that is the effect of the medication. But we want to look at another interesting result here. From 17 to 38, they are switched. So one day they gave the real pill, and the next day they gave the fake pill, and they just switched and made a combination. At the final 38 here, this type, here, with fake pill, they were able to show about 100% following direction. What was the implication of this? Think about this one. They were taking fake pill, so no effect at all, no medical influence, but they were able to show about 100% of the following direction with fake pill. That is the impact and result of the whole counseling and educational intervention. So this experiment show our education and counseling intervention with medication would be the best intervention for the student with ADHD. So that is the implication for this particular experiment. So medication, yeah, that's good, but however, we want to combine with other education so that we can enhance their enhancement of their symptom. Okay, so today we talked about some abnormal development. So students with many mental disorder are originated by many different regions. Any theory can explain perfectly. That's why we want to explore a certain issue from diverse perspective. So we talked about some biological perspective, psychoanalytic, and behavioral and humanistic. And also we want to review some diagnosis issue with DSM-4. And finally, we want to look at some multimodal intervention that include diverse approach, including medication, counseling, educational intervention, consultation, and behavioral modification. Next week, we will talk about next lecture, we'll talk about some counseling, career counseling. That's another important area in counseling. So if you have any question, please post your question. And I'd like to respond to your question. And thank you for listening, and see you in next lecture.